Welcome to a new video. In this video, I will demonstrate how to restore an endodontically treated teeth using post and core system. First of all, I just want to highlight that post and core are indicated for badly decayed endodontically treated anterior and posterior teeth that lost most of their axial walls due to trauma or caries. So, placement of such direct composite restoration in this part will not show the maximum success unless you put a post in the root canal system of this tooth in order to retain the core in its place. Okay, now let's have a look on the instruments and materials that you're gonna use in order to complete these procedures. You should have a self-adhesive resin cement. You should also have either a metal posts kit or fiber post kit and its corresponding drills, Gates Glidden or piezo reamers, cutting and finishing stones, diagnostic set which is mirror, probe and tweezer, endodontic ruler, as well as a dual cured core build-up material, and finally the light cure. Before proceeding with the practical steps, you have to assess the tooth. An assessment of the tooth should be in terms of the endodontic treatment, periodontal health condition, and finally the restorability. Regarding the endodontic treatment, the tooth should be free of any signs and symptoms, has an excellent endodontic treatment, and there is no pain on percussion. Regarding the periodontal health condition, that the minimally accepted crown root ratio is 1:1 and the ideal crown root ratio is 2:3. And finally, restorability of the tooth is detected by presence of 2 mm of sound tooth structure supragingivally, which is called the Farrell effect. And the Farrell effect is very important in order to resist lateral movement that might cause fracture of the root. Okay, now let's talk about the criteria of the posts. Regarding the length, the post should extend till it reaches 2/3 of the canal length, or it can be extended as far apically as possible, provided that you're having 3 to 5 mm of an apical seal in order not to violate the endodontic treatment that you have already done before. And post diameter should be 1/3 the diameter of the root. Now we can get a closer look on the post kits that we have, but before I show you the kits that we have, you have to understand that the posts are classified according to the methods of constructions into ready-made posts and custom-made posts. And ready-made posts are further classified according to the materials into metal posts and fiber posts. This kit is for the metal posts. It's from Dentsply. And as you can see here, all of these posts have the same diameter, which is 0.8 mm, and the kit consists of different lengths, and you have to choose the length that's suitable for each case. And each length has 2 drills. The pilot drill that is responsible for removal of the gutta perca from the root canal system, and the actual working drill. And this one also is the fiber post. This is the fiber post, and this is the corresponding drill of the fiber post that you are going to prepare your canal with. In this video, I will demonstrate how to place a fiber post inside the root canal system of an endodontically treated upper anterior tooth. Now, let's get started with the practical steps. First of all, you have to determine the post length, and determining the post length should be as follows. Place the piezo reamer or the Gates Glidden over the tooth that you are going to work on, like this, till it reaches 2/3 of the canal length. And once it reaches the 2/3 of the canal length, put your rubber indicator or endodontic indicator on a reference point, as you can see here. Okay, and then attach the Gates Glidden into the low speed function. Now cautiously introduce it into the root till the indicator reaches the reference point. We started with the smallest size, and then we're going to the size that is larger. Okay, once the gutta perca is completely removed from the root canal, and you have to make sure that there's no any remnants of gutta perca inside it, you can now shift to the drill. Okay, now I'm done with the preparation, and as you can see here, the preparation reaches 2/3 the canal length, and also the diameter is 1/3 the diameter of the root. Also, the preparation is confined within the path of the root canal without any ledges on the mesial, distal, or even buccal and lingual sides. Now let's try or check the post inside the root canal. Okay, it is perfectly fitted inside the canal, as you can see here, reaching the full preparation length. Now let's go for cementation of the post inside the canal. We will use a self-adhesive resin cement. You can use this small tip in order to be able to intrude the material inside the canal. Slowly inject the material inside the canal. Place your post. You can do also up and down movement or agitation movement in order to avoid the air bubbles inside the monoblock system that you are going to do. Okay, let's secure. start off by placing your dual cured core build-up composite material in order to restore the original shape of the tooth. Inject the core build-up material in this area around the post. Okay, now I'm done with the core placement. As you can see here, let's start preparing the tooth in order to receive a crown. And this is how it should look at the end. Thank you for watching. I hope you enjoyed the video. Stay safe. God bless you all.